Let's talk about carnivore and cholesterol. This is one of the number one questions that I get from newbies who are thinking about trying carnivore and from friends and family, to be honest with you. They're like, Jess, well, how are your labs? Like everyone wants to know, do your labs look okay? Because that's the number one thing that we look at with our doctors at every annual. So let's talk about it. First of all, cholesterol is not the enemy. You need cholesterol for building cells, for brain health, and most importantly, for making hormones. The fear of dietary cholesterol was born from outdated research. Ansel Keys got it wrong. His research in the 1950s blamed saturated fat for heart disease, but he left out a lot of data so that he could fit his theory. So his diet heart hypothesis was flawed, and it led to decades of confusion about fat, cholesterol, and heart disease. So let's talk about important blood markers. HDL is the good cholesterol. It helps take excess cholesterol out of your bloodstream and brings it to the liver to be processed. LDL is labeled as the bad cholesterol. This is the cholesterol that can build up in the arteries when it gets too high. But it's more about particle size and other factors, aside from just the total number. When you're reviewing your lipid panel with your doctor, you want to look at triglycerides as well. You want this to be low. Triglycerides are a fat in your blood. So high triglycerides, higher fat in your blood, can be a risk factor for heart disease. Good news, the carnivore diet helps you to lower your triglycerides. By cutting out processed foods and excess sugars, that can raise this triglyceride number. Eating fatty cuts of meat does not automatically raise cholesterol in an unhealthy way. In fact, on the carnivore diet, many people see improved HDL and improved triglyceride numbers while on this diet that removes all processed foods and all sugars. I always recommend that before you start the carnivore diet, you get your lipid panel done with your doctor so that you have a baseline to be able to compare as you progress in the carnivore diet. Look, I'm not a doctor. I just research a lot of this stuff. And many doctors are going to give you the medication if you have hereditary cholesterol or if your cholesterol numbers are rising because they don't necessarily believe that many people are going to make the lifestyle changes necessary to bring down the cholesterol number, which I still don't believe is the big problem. The LDL going up isn't necessarily a big problem as long as the other numbers are tracking in the right direction. But if you are on cholesterol meds, go ahead and start this diet and monitor your numbers with your doctor. You'll want to monitor your levels and track your progress. So cholesterol isn't the enemy. You can improve your cholesterol numbers by following the carnivore diet with the right guidance and support. Remember that the carnivore diet removes processed foods, seed oils, and sugars, the most common foods that are contributing to high triglycerides and heart disease. By focusing on fatty cuts of nutrient-dense meat, you're supporting your heart with healthy fats, you're lowering inflammation, and you're improving your markers that we've talked about, like HDL and triglycerides.